I would have to do heroin every single day. That was my life. I was like, I got up, got money, and went and got heroin. Yeah, it was just a living hell, and I wanted to quit so bad. I had ended up in this really bad breakup, and one of my big triggers for drug use was depression. At the time, I didn't really want to, be alive anymore. So the most extreme thing that I thought was doing some heroin, and that's what I ended up doing. And if you do heroin like for about 4 days straight, you're pretty much hooked physically.
The same satisfaction that we get with food or physical activity is using these centers that are absolutely normal and necessary, and they are hijacked by the drug. And that's what makes it so difficult to treat.
I came to Dr. Pham a few years ago.
I came to CUC, which is also known as a Community University Healthcare Center. It's really a community health clinic, usually from lower income, sometimes without insurance, and quite often people of color, so they're immigrants and refugees. And that's where my story kind of lies. I'm a refugee. My dad was a South Vietnamese officer. After the end of the war, the fall of Saigon, my dad was in what they call re-education camp, but he basically was a prisoner. And we came to Minnesota because my dad already had an uncle here, and built a life here. But years into the work here, we were experiencing overdoses around town. Many of us realized that we had to do something better for our community.
When you first start doing it, you're actually getting high, but then after you've done it for so long, you're just pretty much maintaining. I mean, you're not even getting high anymore. You're just doing it to not be sick.
This is a disease, as diabetes is a disease, or dementia is a disease, and that's why recognition of this as a disease is so important, because it suggests and offers a treatment.
What it does is it still helps you in a way that it prevents you from feeling the sense of withdrawal, but it doesn't give you that sense of high. It keeps you stable, keeps you feeling normal again, right? And so when you're feeling normal, you can actually cope and make healthy decisions overall.
It's like I'm finally starting my life.
I would meet with someone like Yarrow, but it's always an opportunity to share our stories. And the more I share about myself with others, I think the more of the connection that happens and that community builds on itself. This is where my heart is, and it's always been here. And my colleagues have always been an inspiration for me. I learned so much from them, but it's also been the learners, the students like Koshek.
My family moved to Minnesota as asylees, escaped from ethnic genocide. I understand, what it means to be socioeconomically disadvantaged, not have insurance, have a chronic disease. My dad developed diabetes. It's sort of like coming full circle. Everything that I have fought to make sure that my family has access to healthcare, and my dad dies. And I really question, what's the point of all this? And Dr. Pham was the person who told me, my dad would have wanted this. And that's something that really motivated me. And when someone plays that role in your life, it's big.
When I encounter those who are dealing with any difficulty in life, I've learned just to listen so much more. There's always sadness in the work of medicine, but there's always glimmers of hope.
I'm just happy to be alive. The position I was in, I almost died. And I feel like nothing really compares to overcoming that.